Hi, Aiste. Thank you very much for the introduction and also let us add our condolence from the Global Allergy and Airways Patient Platform as well for the loss of our dear friend Marcus as well. Okay, so it's my pleasure and my honor today to present the patient charter for chronic urticaria. This is a project that has been very dear to the patient community and to healthcare professionals and every stakeholder involved in the patient care. So first, I introduce myself again. I think many of you already know me here, but I'm Victor Gascon Moreno, and the Vice President of Awareness and Operations at GAAPP. So first, let's talk about how this patient charter came across. So GAAPP conducts a monthly group meeting that we call the Urticaria Coffee Chats, which is basically a networking of patient organizations working in Urticaria. And so we always talk to them, what do you need? How do you think we can advance advocacy? And actually, in one of the UCARE events in Berlin, if I'm not mistaken, 2 years ago, we all came with ideas like we really need a chart, just like the one we have for asthma and COPD. We need to set up what are the basic rights of urticaria patients so everyone can aim to follow these gold standards. So as this charter was spearheaded by the patient community, we started the work in the charter with a very inclusive approach. So this charter represented 5 patient organizations from every continent. You see some of them in the screen. We had 6 healthcare professionals and experts from relevant medical centers, university centers of excellence. We had Marcus from the Charité and professionals from the Quebec University, the University of the British Columbia, and all of this you can see on the screen. And we also have one pharma industry representative because we always work in a multi-stakeholder approach for patient care. So as we always say in the patient community, nothing about us without us. So this is how we started the work in the charter and the publication that later became very successful. And I'm going to show you. So this is the 5 principles of the charter. Later you will see the publication and this version, we have 2. But this is the best to present what are the 5 basic rights or how would we define the 5 basic rights. So before we go into each of them, I think that the reaction of many of you will be like, how can I implement this in my country? I don't even have number 2, but that's exactly why. So that's why we create the charter, because this is what the aim of the golden standard care for urticaria, the golden standard rights, for urticaria patients. So this is what you should strive to achieve in your country with our help, with the help of healthcare professionals and societies and policymakers, industry, everyone. This is the basics that you should achieve and that we should fight to have in each country. And we are very conscious that most of the countries don't have, they would not be able to tick most of the 5 boxes here. So the first right, the first right is I deserve an accurate and timely diagnosis of my chronic urticaria. We know most of urticaria patients take years to get a diagnosis. They go around primary care here and there, secondary care, they go back. So every patient should have the right to have a timely diagnosis. The second is I deserve access to specialty care for my chronic urticaria. Every patient should be able to access, if necessary, if needed, specialty care, specialists, dermatologists, immunologists, allergologists, to ensure that the urticaria is properly diagnosed and that the treatment that is following guidelines is being applied. The third right is I deserve access to innovative treatments that reduce the burden of my chronic urticaria in my daily life. Many of the patients around the world, they are not aware of novel treatments. They are not aware of biologics. So we believe that everyone should know what is out there, what treatments exist, and then work with your healthcare professionals in this process that we call shared decision making that my colleague Kristen is going to talk to you about it later extensively. So every patient should have the right to have this process with their healthcare professionals to see what is the best treatment that I can achieve, what is the best care that I can achieve that also it is in line with my lifestyle, right? So the fourth point here, the fourth right is I deserve to be free of unnecessary treatment-related side effects during the management of my urticaria. And this is also related to shared decision making. So every urticaria patient should have the right to have a medication or a treatment that is not burdening their quality of life, that is allowing them to be treated, but at the same time to be able to be productive, to have a work life, a family life, to have hobbies, and to have a quality of life that is as achievable or as fulfilling as a quote unquote healthy person. And the fifth right is like I expect a holistic treatment approach to address all the components of my life impacted by chronic urticaria. That means when we talk about treatment, we should talk in a holistic way. We should be able to achieve treatments not only in pharmacologically speaking, but we should also consider mental health. What is the mental health burden of urticaria? We know is very high. Depression, anxiety, isolation, those are rampant amongst urticaria patients. So we should think about urticaria treatment in a holistic way, not only pharmacological. So this is the five basic rights. You have them explained in a much detail in the charter itself, in the publication, and I will show you how to access after. So this is where the charter has been presented at so far. So I had the play. This is me, possibly very awkward in Sao Paulo conference in the UCARE. So we we launched the charter in the UCARE event in Sao Paulo last year. We have presented and endorsed and start using the charter among our coffee chats groups that we have. I have already explained to you about, and Christine will also explain to you later. We have presented the charter in our GAAPP annual events. We have 2 annual events that bring more than 150 patient organizations, industry partners, and policymakers to the conversation. And number 4 is today. Today is the fourth occasion where I can present these charters. Actually, this picture, I'm a little bit like, this picture actually was taken by Marcus. So we hope that this charter, because he's one of the authors, so we really hope that this charter also works as a way to honor his legacy and all his work, and in a way, to have something that will continue his legacy in Urticaria. So we are very glad that the patient charter is one of those things that will remain, that will have a piece of his soul on it. So this charter is available in 2 forms: the publication in the peer review as in a peer review form. You can see the QR codes here on the right. So in the right is the scientific publication, but then we also have a summary or simplified version, a 2-pager of the patient charter for everyone to be able to understand, because we know not every patient is able to understand scientific publication or peer review publications because they are long, they're using scientific language, they're using difficult medical terms. So we always have a layman summary of everything that we produce or we publish. So the simplified version is also available here. You have the QR code that you can scan. This is already available in English, in French, in Spanish, Portuguese, Italian, and we are working in new translations in Russian and other languages that they are requested to us by our members. So with that, I want to say thank you, everyone, for allowing me to present this very important advocacy tool for the community. Thank you, the UCARE Galen team, for allowing us, always giving space for patient organizations to be able to present our projects, and I will give the word back to Aiste.